It's nice to see everybody here this afternoon. My name's Ed Town, and I'm a liver specialist here in Vancouver. I'm going to give a little bit of a warm-up and talk a little bit about understanding your liver before we delve into the details with the rest of our panel as we go. It's a pleasure to be here, and thanks for being here on a sunny day outside. It's beautiful out there. So I'm going to just give a little bit of an overview and a couple facts about your liver just to kind of whet the appetite for the education this afternoon. And many of you might already know this, but the liver is the largest solid organ in your body. And this is what it looks like, and we're here to learn about it this afternoon. You know, it is the biggest organ, and when you talk about exactly how big it is, was kind of like asking how big is the normal human hand, right? I mean, there's a general sense of it, but there's a variability depending on the size of the individual. But it's about 1.5 liters in volume, about maybe 3 pounds or so in weight. It's a pretty big organ. And as far as where it is, well, first of all, we only have one liver. Did everybody know that? I was reminded recently that it's not common knowledge. A nurse was drawing my blood for an insurance physical and was chatting with me about what I did for a living. And she said, "We have two livers, right? Isn't that right?" But no, we have one, and it's on the right side. It's tucked in. It's protected underneath your rib cage there. So if somebody gives you a little bit of a nudge, it's protected. And well, I think of the people in the room, we could probably all agree that maybe your liver is the most important organ in your body, but it's certainly one of the most important. It does a lot of things. It filters the blood. It helps us metabolize nutrients and drugs. It makes most of our body's proteins. It stores energy for us. It regulates hormone balance, and it makes it possible for the blood to clot. And this is just a small sample of the many, many things that the liver does for us every day. And yes, just as the name of the forum is, you cannot live without your liver. So if we take a little bit closer look at this organ, we're here to talk about liver health. And I think one way to talk about liver health is also to think about how often or common it is that things could go wrong with the liver. This is a little map of the world talking about one of the most common causes of liver disease that we see in the world, called non-alcoholic fatty liver disease, or now what we call it metabolic dysfunction associated steatotic liver disease. Different name, same condition. And so to think about why we're here to talk about the liver and why it's important, we can think about how common it is that people may be affected by liver disease. And if you focus just on this condition of fatty liver, or steatotic liver disease, if we call it as such, you can see in this heat map throughout the world how common it is. And in Canada, we believe it affects about 25% of adult individuals, 1 in 4. So we can just think this single liver condition in Canada, how many people are affected, and this doesn't even take into account the many, many different causes of liver disease that we're faced with. Whether you're talking about fatty liver or steatotic liver disease or other things that can affect or damage the liver like toxins, viruses, the body's own immune system, we think about what happens over time as a progression from the liver being soft and pliable and without significant scar tissue to a very scarred and fibrotic liver that can eventually develop due to any cause of ongoing inflammation or disease process. And when liver disease gets that significant, when scar tissue becomes that severe, then you have cirrhosis. And what's being shown on this slide is, a diagram of what a normal liver may look like and then a cirrhotic liver. Now, it used to be that we would think a lot about, of course, prevention, and we still think about that a lot. Now, of course, we want to prevent damage to the liver. We want to prevent the development of scar tissue and fibrosis. But what we have started to understand over time is you can actually reverse this process. And so it used to be felt that fibrosis or scar tissue in the liver, once you're on that path, it was an irreversible process. And maybe you could prevent further progression, but it was not well understood a number of years ago that you can actually reverse this condition. And in fact, you can, and that's been proven across different disease states. So now we talk about prevention, but we can also talk about treatment that can even improve the condition and situation. Now, if you're going to see your primary care provider, or if you end up seeing a liver specialist for whatever reason you're getting evaluated, there's a few different tools that we like to use to understand what's happening with the liver and if there's a process that might be affecting it, a liver disease or otherwise. And blood work is a really important part for most individuals, and this is really a key part of diagnosis and monitoring for individuals with liver disease. Imaging is very common, and ultrasound of the liver or other types of images are a pretty common way to go about it, and oftentimes liver disease is picked up incidentally when we do ultrasound. Now, this is not an ultrasound of your liver. If your liver looked like this, you'd be in trouble. This is a baby. My friend and his partner are actually at the hospital right now. They're going to have twins today. It's an exciting day. In tribute. I recognize that's not a liver, just in case you were worried. That's um, Now, once you think about non-invasive tools, and we would consider blood work pretty non-invasive, it's a pinprick, or a small needle, but not a big deal perhaps. Ultrasound being quite non-invasive. Traditionally, and still now at some times, you need to take a closer look. And liver biopsy is a tool that traditionally has been used not only to aid in diagnosis, but also to understand stage or severity of liver disease. And liver biopsy really used to be the tool that we would rely on in particular to stage fibrosis or scar tissue. And a little diagram of how it happens, I mean, it's no mystery. A core needle goes into the liver, it recovers a piece of tissue about 2 centimeters long, and then you can learn a lot under the microscope. The challenge is, of course, it's an invasive procedure. It's resource intensive, and from a patient perspective, nobody really likes to have that done if at all possible. So over time, we've been trying to understand the liver better by developing more accessible and non-invasive tools to maybe get this type of information without having to go to the trouble and the risk of doing biopsy. And to think about where we've gone in that conversation, we need to learn a little bit about cheese first. So here's a picture of Mahon cheese, which is a cow's milk cheese from Spain, which is typically aged in a cave and is known for its delicious tangy flavor. And the challenge with Mahon cheese is to know when it's done being aged in a cave. Typically, you would need to take a little core biopsy of that cheese wheel that's breaching the surface and then examine it and understand if it was ready to go. And over time, food scientists wanted to understand, is there a non-invasive way we could do that? Is there a way we could figure out if that cheese was done ripening without poking a hole in it and disrupting that wheel? And this is what they came up with, published in the Journal of Dairy Sciences in 2000. Basically a computer and a transducer and a piece of cheese there, trying to figure out what you could learn from that piece of cheese by measuring its stiffness. Well, somebody smart shoved a piece of liver in there, and instead of olive oil as coupling fluid, decided to try normal ultrasound gel, and this is how the method of transient elastography or liver stiffness measurements by a tool called FibroScan ended up being kind of brought into the clinic. And so now we can use a tool like FibroScan, which many of you may have heard of, in different forums, a tool to non-invasively measure liver stiffness. And stiffness is important, just like it is for cheese. Liver stiffness is important because a soft and compliant liver is a healthy liver, and a stiff and fibrotic liver is one that may be on the path toward cirrhosis. And so now FibroScan's become a tool that we use commonly in the clinic, a point of care, and of course that the CLF has been doing in the public as a public-facing risk screening tool, which has been a great initiative by the CLF. And this is really all it is. It's just a probe with a vibrator and a transducer there. It's placed on the surface of the skin. Many of you in this room may have had one of these before. All you feel is a little tapping on the skin, and when that happens, a wave is transmitted through the liver, and the propagation of that wave is tracked with ultrasound, and then you can calculate liver stiffness, and then you have a very good understanding of how much scar tissue or fibrosis is in the liver without putting a needle in it. And so you get a number and you can interpret it. And a lot of work has gone into validating FibroScan readings as it relates back to the gold standard of biopsy, to the point where now the frequency at which we do liver biopsy is much, much reduced by the availability of this tool. And of course, biopsy still has its role. FibroScan is not a complete replacement for it, but we're having newer tools and newer technology to get answers to understand the liver less invasively. So as we know different tools we can use to learn about the liver and understand disease processes that may be affecting it, and we're going to learn about specific diseases as we go this afternoon. A lot of people want to know, when it comes to a healthy liver, where can we start, really? So if we flip it the other way, and instead of thinking about liver disease, if we think about liver health, where can we start? And in a vein and conversation of liver health, one of the commonest questions that I get, I would say, if I'm speaking to the public or even from patients, is, what type of alcohol is safest, for my liver? And people wonder, well, if I switch from beer to wine or wine to spirits, which one is best for my liver? And in a way, yeah, I mean, it's maybe it's a little bit funny, but also if you flip it, it's kind of understandable why this question would come up because there's been a lot of mixed messages out there. And even say with red wine, how many of you out there have heard at some point in your life that red wine may confer cardiovascular or heart health benefit, right? Like these messages float around, and sometimes it's hard to understand, well, what is healthy and what is not. So I understand why people ask the question, but from the laughter in the room, it seems that most of you would know that it doesn't really matter whether it's coming from beer or wine or spirits, or it's the alcohol component that we might be concerned about. So, but this is an important question, and I always appreciate it when people are straightforward and ask about it, because it's important to talk about. Now, many of you may have encountered Canada's new guidance on alcohol and health. And I think this, which kind of came out into the media last year, really stimulated a lot of conversation around alcohol and health, and understandably around alcohol and the liver as well, because I think the liver is an organ that often is connected to this kind of conversation. And I think many of you probably saw something in the media about this recent guidance suggesting that, number one, data now is quite definitive, demonstrating that there is no beneficial amount of alcohol to consume. So there's no cardiovascular benefit to consuming alcohol. That was a question before. It's been proven to be incorrect now. And then what they were trying to do in this guidance is to kind of give people an understanding of, well, what does alcohol mean for the overall health? And keep in mind, this is about alcohol and health and not just about alcohol and the liver. The conversation around alcohol goes beyond the liver, and it's really about your health in general. And I think we can talk about liver disease and liver health, but really we're talking about the person and everything that goes into that conversation. And you can see here that it's 0 drinks per week. Okay, you're in good shape for sure. Okay, understandable. But what is the safe level, or what is the recommendation? What do you take from this information? As you can see here, 2 standard drinks or less per week, you're likely to avoid alcohol-related consequences. But if you read the document, it's clear that any amount of alcohol consumption is associated with some degree of risk. So they had to present this some way, and the media ran with this globally. It's incredible to see actually a set of Canadian guidelines being picked up globally, and the conversation around this was quite stunning. And people were losing their mind when this came out, taking away from this that if you have more than 2 units of alcohol a week, that you were doing major harm to yourself. And it's interesting because at our national meeting for liver disease in Canada, we invited the chair of the guidelines to come and chat about this and to teach us about the guidance and what they wanted people to take away from the guidance. And they really felt that the conversation in the media and in the public was wrong as far as what their intention was. And their intention is they put this guidance out there because they wanted people to think about their consumption of alcohol, to think about how much they were consuming. In Canada, a bottle of wine is not labeled. So you buy a bottle of wine and you don't know how many units of alcohol is in that bottle. In Australia, you'll pick it up and it'll say there's 6.3 units. So in Canada, we don't even know, I think at a public level, how much we might be consuming. And so the purpose, I think, of this guidance was to have people understand that everything we do, most things we do, are associated with some degree of risk. And I think we need to think about it. And when it comes to alcohol, there's benefits to cutting back, and the benefits might be greater at higher levels to cut back. And how this relates back to liver disease, I think, is leading a healthy lifestyle or doing the right things for your health is not about eliminating all risk in your life, but I think it's about thinking and being mindful of what we're doing and understanding, how we put all of that together for our own health. And so the answer to safe alcohol consumption and liver disease is a challenging one at the early stages of liver disease, because I think you can have a conversation. At the later stages, we know that 0 alcohol is safe, that's for sure. But this is a conversation that comes up frequently, and I think is a good model just to think about preventative health in general and how we take information and kind of work it into what we're going to do on a day-to-day basis. So this brings me almost to the end, and just a quick question. People often ask me this question in a way, or they ask me about liver supplements or things that we can do to improve liver health. So my question for you is, in my fridge, what are you going to find? Are you going to find liver cleanses, liver flushes, or lots of fruits and vegetables? Do you think? No, I know I just met most of you, so you might not know what's lurking in my. But I will tell you, it's fruits and vegetables. Okay, and so, one of the things that is out there a lot, I would say, is the need for our livers to be protected by taking supplements or to detoxify it by cleansing it in some way. And for sure, I mean, you can go to the internet and you Google liver cleanse or liver detox, and there's so many different and in many ways reputable looking steps that you can go through to cleanse your liver or supplements that might be recommended that you can take to improve your liver health. And when you go on the internet, again, a lot of this information looks very reputable. And this is just an example of one of many websites that you can encounter, on the web, of course. And it's hard to know, where good information is coming from, which is why it's so great that you're all taking time out of your day to be here to engage in this kind of discussion. But I wanted to mention that when it comes to most of these types of supplements, really they are not scientifically proven. And even if you think about, if you walk down the street right now to Whole Foods and you look at the shelf that has all the liver supplements on there, one of the most common ingredients will be milk thistle, and that's probably the thing I get asked about the most frequently. And the thing that I see most of my patients, if they're taking something, they're probably taking something with milk thistle in it because they've heard it's good, or they've been told it's good, or they just see a shelf full of this stuff and figure it must have some benefit. But even milk thistle itself has actually been studied in well-designed randomized studies across a couple of different liver disease indications and does not appear to work in the way it's being marketed, that's for sure. And a lot of these supplements are potentially expensive. To be honest, most often they're not harmful, but I think any of us who see individuals with liver disease, we encounter individuals regularly who do experience drug-induced liver injury from supplements, from things that were meant to help. And my most memorable recent encounter with this was early in the pandemic, actually switching over to telehealth. I was doing a telehealth consultation. And it's interesting because usually you do a new consult, a patient is seeing you in your office, in your zone. Well, when you're doing a telehealth visit with somebody, you're seeing that patient in their zone. And so I was referred somebody for abnormal liver tests of unclear etiology, and the primary care doc had done a pretty good workup already, and it was a mystery why these liver tests were abnormal. So when they popped up on the screen, I introduced myself. The first thing I noticed is that they were sitting in front of a shelf of supplements. And when we came to chat about what they did for a living, they market supplements and they were taking a lot of supplements. And indeed, it was in the moment, it's like, I'm pretty sure I know why your liver tests are abnormal. And that's what it was. Yeah. So I'm not saying you cannot take supplements, but I think it's important to have realistic expectations. Just as I already said around alcohol, everything we do has potential risks and benefits. And I think it's important to keep it realistic, understand how it applies to your situation and what makes sense when you're trying to fit this into a healthy lifestyle. So if I were to just end this quick little intro about where we could all start with a healthy liver, the first thing I would say is not to underestimate the importance of regular exercise and healthy diet. I led by talking a little bit about this condition that's super common of fatty liver or steatotic liver disease. And before we really dive deep into drugs that are going to help with that condition, we understand the backbone is going to continue to be lifestyle modification. But it's not just about treatment. Prevention is important. Staying healthy is important, and not to underestimate the power and importance of healthy lifestyle as it relates to diet and activity. Fortunately, later on this afternoon, you're going to get some very practical advice around that. So I think that's going to be really exciting. Lastly, I just didn't have time to talk about all the different causes of liver disease, of course, but if there's a couple little mini messages, the second message I would have is to know your hepatitis B status. Hepatitis B is a virus that can affect the liver, and it's very common in certain parts of the world, less common in other parts. But as we can see, I think as a global trend, we're thinking more and more about making sure that, in particular, every adult knows their status. In the United States, they've recently moved to a universal one-time screening recommendation that every adult should get tested at least once for hepatitis B. I think in Canada, we very well may see that recommendation soon also for adults. And I think knowing your status with a simple blood test makes sense when it comes to hepatitis B. Similar trend, know your hepatitis C status. The Canadian Liver Foundation was the first national body in Canada to issue a firm recommendation around hepatitis screening in a birth cohort, meaning that instead of basing the need to screen and test for hepatitis C in a population based on risk factors to have it, it was suggested by the Canadian Liver Foundation based on evidence a number of years ago that anyone born between 1945 and 1965 or 70 be screened at one time for hepatitis C. And the reason this is important is because it's treatable and curable. And in fact, Canada has signed on to this World Health Organization initiative to eliminate hepatitis C by 2030. And so knowing your status is important, and I referenced the United States. Yes, the U.S. has gone to universal hepatitis C testing recommendation as well, and I think in Canada we are building momentum around that too. So I think it's a reasonable statement to suggest that you should know your status as well with a simple test here. So those three little things would be a pretty reasonable start, but we're going to learn a lot more as we go on this afternoon. So thank you very much for your attention.